Hey there, fellow microbe enthusiast. Remember that deep dive you requested on trachoma? Well, we're diving in right now. Get ready, because it's a wild ride, especially for a microbiologist like you. We're tackling the world's leading infectious cause of blindness. Crazy, right? Especially since it's entirely preventable.
It really shows how microbiology, public health, and global health equity are all connected.
Totally. And we're going way beyond the basics today. We've got the World Health Organization's Aware book as our guide.
Great resource.
It is. So before we get into the nitty-gritty, can you break down trachoma for us? What exactly are we dealing with?
So trachoma is a bacterial infection, and it targets the eyes. It's caused by certain types of Chlamydia trachomatis, but, and this is important, not the same kind that causes the sexually transmitted infection.
So just so everyone's clear, not your typical chlamydia.
Exactly. Different strains, different game. We're talking about serovars A, B, BA, and C of Chlamydia trachomatis.
Got it. So these guys love the eyes. Let's say you're examining a patient. What would make you suspect trachoma? What are the telltale signs?
Well, clinically, trachoma have two main stages, acute and advanced. In the acute phase, you see the classic conjunctivitis signs: redness, irritation, discharge, and light sensitivity.
So basically pink eye.
Kind of, yeah. Especially in kids, it can look a lot like ordinary pink eye at first.
Ah, so that's where the microbiologist's expertise comes in.
Precisely. And it gets really serious in the advanced stage, which develops after years of repeated infections and chronic inflammation. You start seeing trachoma's real hallmarks, scarring on the conjunctiva, and then trichiasis.
Trichiasis. That sounds rough.
It is. Trichiasis is where the eyelashes actually turn inward, constantly rubbing against the cornea.
Ouch. I bet that's uncomfortable.
Incredibly. And
Yeah.
that constant irritation from those inward-turning eyelashes, that's what leads to corneal scarring and damage, eventually causing vision loss.
Yeah.
And, even blindness. It's a slow, progressive process, but it's incredibly debilitating.
So it's a chain reaction. This bacterial infection can actually lead to blindness. That's where we're focusing on it. Now, before we get to the how and the why, let's talk lab tests. How do we even detect trachoma?
The Aware book is all about practical approaches. And practically speaking, the diagnosis is mostly clinical, based on those characteristic signs and symptoms.
So observation is key. But what about confirmatory tests?
They're not usually needed for individual patients, but microbiology tests are super valuable for surveillance, research, and figuring out public health strategies.
Okay, makes sense. So when we're talking microbiology tests, what are the go-to methods?
No aids, for sure. Nucleic acid amplification tests, they're really sensitive and specific, can pick up even tiny amounts of Chlamydia trachomatis DNA in conjunctival swabs.
I bet our microbiologist listeners are familiar with NASEs.
Yeah.
Any other tests used sometimes?
The book mentions microscopy and culture, but not as common as NAIDS.
Makes sense. What about other types of lab tests? Blood work, things like that?
Nope, the Aware book is clear on that, no need. It's all about those clinical signs and specific microbiology tests.
Streamlined? I like it. What about imaging? X-rays, anything like that?
Not for trachoma. The book's pretty clear. It's a visual diagnosis, confirmed with those microbiology tests.
No unnecessary procedures. That's good. Okay, so we know how to identify it. How do we fight back? What's the treatment plan?
Two-pronged approach, tackling the infection and managing those complications, especially trichiasis.
Strategic. Let's start with the infection itself. What's our weapon of choice?
Antibiotics. The Aware book actually gives some very specific guidance on this, which is super helpful for healthcare pros in trachoma endemic areas.
Okay, our microbiologist listeners are definitely interested in those recommendations. What's the go-to for this infection?
Oral azithromycin. Single dose, 20 milligrams per kilogram of body weight, max of 1 gram for adults, 500 milligrams for kids. And here's the interesting part. That single dose is given every year for 3 years.
Wow, 3 years. That's a long time.
It's about breaking the cycle of transmission. Hitting that bacteria hard over a long time reduces the infection reservoir and prevents reinfection.
A long-term strategy. So it's not just about the individual, it's about protecting the whole community. Now, what if you can't use oral azithromycin? Any alternatives?
You can use topical antibiotics, but they're not ideal. The book suggests azithromycin eye drops, 1.5% concentration, 1 drop in each eye, twice a day for 3 days. Or tetracycline eye ointment, 1% concentration, twice a day for 6 weeks.
6 weeks of eye ointment. That's dedication. So oral's definitely preferred. We've covered the infection, but what about trichiasis? How do we deal with that?
Surgery. Straightforward procedure to correct the eyelid and stop those eyelashes from rubbing against the cornea.
So antibiotics for the infection, surgery for the complications. A two-pronged attack. But what's going on at the cellular level? How does this tiny bacterium cause so much trouble?
That's where the fascinating world of pathophysiology comes in. Chlamydia trachomatis is small, but it's got some clever tricks.
All right, let's dive into the microscopic battleground. How does this infection actually take hold?
It's spread mainly through direct contact with eye secretions from someone who's infected, often carried on hands, clothing, or contaminated objects. Flies can be vectors too.
So hygiene and sanitation are key, especially in crowded conditions. Makes sense. Once the bacteria gets in the eye, what happens? How does it cause all those symptoms and complications?
Chlamydia trachomatis is an intracellular bacterium, meaning it invades and replicates inside our cells. In trachoma, it targets the conjunctival epithelial cells, the lining of the eyelid and white of the eye.
So it's burrowing in. What does that trigger?
An inflammatory response. Your body's trying to fight back, which is what causes the redness, swelling, and discharge you see in acute trachoma. But here's the thing, that inflammation, while it's fighting the infection, can also backfire.
How so?
Well, repeated infections and that resulting chronic inflammation, that's what ultimately causes the scarring and damage you see in the advanced stage.
So the body's own defenses are contributing to the problem.
Exactly. That chronic inflammation is what leads to trichiasis. The conjunctiva thickens and scars, distorting the eyelid and causing those eyelashes to turn inward. A whole cascade of events, all from that initial bacterial invasion.
Wow, this tiny bacterium is causing quite the chain reaction. It shows how complex the interplay between host and pathogen can be. Okay, let's zoom out. How big of a problem is trachoma globally?
It's a major public health concern, especially in the poorest parts of the world. It's estimated to cause about 1% of global blindness. And while that might not sound like a lot, it translates to millions of people living with vision loss or blindness, all because of a preventable disease.
Millions, that's a lot. Where's it most prevalent?
Primarily sub-Saharan Africa, especially areas with limited access to clean water, sanitation, and healthcare.
It's that cycle of poverty we were talking about. The conditions allow trachoma to spread, and then the disease, especially when it leads to blindness, can worsen poverty. It's a terrible situation. We've been talking about the bacteria throughout our conversation, but let's be super clear for our listener. What exactly causes trachoma?
The culprit is Chlamydia trachomatis. But specifically, serovars A, B, BA, and C, it's not all Chlamydia trachomatis strains, just those specific ones.
Right, just those 4. So our listeners should be able to define trachoma, describe how it presents, discuss lab tests, and even explain a bit about the pathophysiology and epidemiology. But before we move on, how about a little pop quiz? Ready for some rapid-fire questions?
Hit me with your best shot.
Okay, question 1. What's the most common way trachoma is spread?
Direct contact with eye secretions.
Correct. Question 2. True or false, trachoma and chlamydia, the STI, are caused by the exact same strains of Chlamydia trachomatis?
False. It's those specific serovars A, B, BA, and C that cause trachoma.
2 for 2. Question 3. What's the name for those inward-turning eyelashes in advanced trachoma?
Trichiasis, that's the one that causes so much corneal damage.
You're on fire. Question 4. What antibiotic is used in those mass drug administration programs for trachoma control?
Oral azithromycin, given once a year for 3 years.
Last one. What does the F stand for in the WHO's safe strategy for trachoma control?
Facial cleanliness. Simple but effective.
You aced it. 5 for 5. We've covered a lot in this first part. From the microscopic world of Chlamydia trachomatis to the global burden of trachoma. But we're just getting started. Next time, we'll dig deeper into the epidemiology, those social and economic factors, and the fight to eliminate this preventable disease.
It's going to be interesting. Welcome back. We're shifting gears now, moving from the microscopic view to the bigger picture. Time to talk about the epidemiology of trachoma.
Yeah, it's not just about knowing the bug. It's about understanding the whole context. So how big of a problem is trachoma, really?
It's a big one. Even though it's preventable, trachoma is still a major public health issue, especially in the poorest parts of the world. The WHO thinks over 137 million people are at risk right now. Most of them live in sub-Saharan Africa.
137 million. Wow, that really highlights the global health inequalities out there. But it's not just geography, right? What makes some people more likely to get trachoma?
Exactly. The Aware book talks about a few key risk factors: poverty, overcrowding, not enough clean water or sanitation, and weak healthcare systems.
It's that cycle we talked about, right? Those conditions make it easier for trachoma to spread, and then the disease itself, especially if it causes blindness, makes poverty even worse.
Yeah.
It's a tough situation.
Mhm.
The book doesn't talk much about the economic impact, though, does it?
Not in terms of exact numbers, but it definitely emphasizes that trachoma has a big economic impact, both directly and indirectly.
I can imagine. What kind of indirect costs are we talking about?
Lost productivity, people not being able to earn as much, families struggling, and caregivers having to take care of people with vision problems. It affects whole communities.
It's a reminder that the cost of these preventable diseases goes way beyond just healthcare. It impacts people's lives in so many ways. Okay, let's talk more about how trachoma spreads. We know about direct contact and flies, but anything else our microbiologist listeners might find interesting?
Young kids are the main source of infection, especially under fives. They're more likely to have active trachoma, so they spread it more within families and communities.
Makes sense. They're not always the best at hygiene. So focusing on that age group is really important. We've talked about the problem, but let's talk about solutions. We touched on the SAFE strategy, but let's break it down.
SAFE is a comprehensive plan from the WHO. It's not just about treating people who are sick, it's about stopping the spread and making communities healthier.
Like that, a holistic approach. What does S stand for?
S is for surgery, specifically for trichiasis, those inward-growing eyelashes. Surgery is crucial to fix the eyelid and protect the cornea.
So it's about preventing that long-term damage. What about A?
A is for antibiotics. We talked about how important they are for treating trachoma. The WHO recommends mass drug administration of oral azithromycin. Giving it to a lot of people at once helps reduce how much infection is circulating.
Targeting the bacteria on a community level. And F?
F is for facial cleanliness. It sounds simple, but it's really effective. Hand washing, especially after touching eye secretions, and clean water for washing faces.
Basic hygiene, but so important. And finally, E.
E is for environmental improvement, basically improving sanitation. More latrines, safer ways to get rid of waste. That helps reduce breeding grounds for flies, which can spread the infection.
So it's about more than just medicine. It's about making the environment healthier. What about education? Does the book mention that?
Definitely. Education is a huge part of the SAFE strategy, making people aware of trachoma, how it spreads, and how important early treatment is. It's about giving communities the tools to protect themselves.
Empowering communities, that's great. Now, for our microbiologist listeners, what are some of the challenges and opportunities in trachoma control?
One big challenge the book mentions is antibiotic resistance. Mass drug administration with azithromycin is so important, but if resistance develops, that could be a huge problem.
That's a scary thought. Antibiotic resistance is a global problem. Are there any ways to tackle it?
The book says we need to keep a close eye on resistance patterns, basically doing surveillance and making sure treatment guidelines are up to date. Researchers are also trying to find new antibiotics and treatment approaches and even vaccines.
It's a race against the bugs. What about opportunities? Any exciting new developments?
One really promising area is point-of-care diagnostics. Imagine being able to diagnose trachoma quickly and easily, even in remote places, without needing fancy lab equipment. That would be amazing.
That would change everything, especially in places where healthcare is hard to access. We've covered a lot in this part. The epidemiology of trachoma, how it spreads, the impact it has, and the strategies to fight it.
And now we're going to zoom back in. Time to get up close and personal with Chlamydia trachomatis itself.
Welcome back. We've gone from the global picture all the way down to the individual level. But now, it's time to put on those microbiologist hats. We're getting up close and personal with Chlamydia trachomatis itself.
This bacterium is fascinating. Tiny, but it packs a punch. And it's biology that makes it such a successful pathogen, especially when it comes to trachoma.
Okay, I'm ready for the microbiology lesson.
Yeah.
What are the key things our listeners should know about Chlamydia trachomatis?
Well, first off, it's a gram-negative bacterium.
Ah, so important for staining and antibiotics.
Exactly. And Chlamydia trachomatis is an obligate intracellular parasite.
Meaning?
It can only survive and replicate inside a host cell, like a little hijacker taking over the cell's machinery.
Sneaky. How does it even get into those cells?
The Aware book doesn't get into the specifics, but it does say that Chlamydia trachomatis has a biphasic life cycle. It switches between two forms, elementary bodies and reticulate bodies.
Two forms. Okay, I'm listening. What's the difference?
Elementary bodies are the infectious form. They're tough and can survive for a bit outside of cells, which is how they spread so easily.
So they're the tough guys ready to invade. What about the reticulate bodies?
Reticulate bodies are the ones that are metabolically active. Once inside a cell, the elementary bodies turn into reticulate bodies, and then they start replicating. They make more and more of themselves inside these little pockets in the host cell, and then bam, they turn back into elementary bodies and go infect other cells.
A real Trojan horse situation.
Yeah.
The elementary bodies sneak in, transform, multiply, and then burst out to infect more cells. It's pretty impressive. It's a scary kind of way. We've talked about Chlamydia trachomatis in general, but you said not all strains cause trachoma. Which ones do?
Right. It's important to remember that. Serovars A, B, BA, and C, those are the ones that cause trachoma.
The eye specialists. Anything special about them, biologically speaking, that makes them target the eyes?
The AWARE book doesn't get into those details, but some research suggests they might have certain surface proteins that help them stick to and invade those conjunctival cells.
So little differences in the bacteria can cause totally different infections. That's microbiology for you. What about the body's response to this infection? We've mentioned inflammation, but what's happening on the immune system side of things?
It's complicated. Both innate and adaptive immunity are involved. At first, it's mostly cells like macrophages and neutrophils trying to gobble up the bacteria.
The first responders. What about the adaptive immune system?
That kicks in too. T cells and B cells come to the infection site. T cells help organize the immune response and kill infected cells, while B cells make antibodies to target the bacteria.
So the body is fighting back on all fronts. But we know that inflammation can be a problem in the long run.
Definitely. It's a necessary part of the immune response, but it can also cause damage. Okay, so big picture, what are the key takeaways for our microbiologist listeners?
What should they remember about this sneaky little bacterium?
It's a master of disguise and manipulation. The life cycle, hiding inside cells, causing that chronic inflammation, that's all part of what makes it so successful.
Even tiny microbes can have a huge impact. Understanding them is crucial if we want to fight the diseases they cause. Well, I think we've covered it all. Definition, symptoms, lab tests, treatment, the epidemiology, and even the deep dive into the microbiology of Chlamydia trachomatis. Our listeners should be ready for anything.
Absolutely.
And I hope they're inspired to use what they've learned to help fight trachoma. It's a tough problem, but we can make a difference. Thanks for joining us on this deep dive into trachoma. We'll be back soon with another fascinating exploration of the microbial world. See you then.